Hello and welcome back. If you're just tuning in, you're watching the Arthritis Show, a global information source dedicated to patients with arthritis and sports injuries. But joining us today exclusively in our studios is Dr. Ryan Fisher. Welcome, Doc.
Welcome.
Great to have you.
Oh, it's a pleasure to be here.
Excellent.
I think it's a great service what you guys are providing, especially since there's so many people out there that do suffer with arthritis, and a lot of them just don't know what to do.
Thank you very much. Well, arthritis and sports injuries is a very common phenomenon in our country. It's one of the most common office visits to a physician is typically a back pain. I'm sure you get to see quite that often, right?
Oh, yes. I mean, especially being down here in South Florida with the elderly population, arthritis is prevalent down here. And, you know, what we're seeing with these arthritic patients, we're seeing very similar patterns. They're very stiff when they're waking up in the morning. It takes them a long time to get their day going. And a lot of them are just living on medications, the NSAIDs, the over-the-counter medications, which, you know, typically in the long run can have detrimental effects. So we try to provide a all-natural relief for these patients. And we know arthritis isn't something that we can cure, but if we can get a patient feeling better and functioning better, we know we're doing a good job.
Exactly. Now, one of the more common things that you get to see is back pain, right?
Yes, that's correct.
Do you see more males or females in your practice, Doc?
Well, we probably see more females in the practice, and I don't attribute that to more females having back pain, but we know men, we like to wait until the last minute until we're literally in excruciating pain till we go see a doctor.
That's certainly correct. That's something that I do get to see in my practice as well. I think men usually like to wait a bit longer, and women are more aware of their pain, and they seek to see a doctor sooner. Now, you like the decompression unit, right?
Yes, we offer a non-surgical spinal decompression therapy in our office. Specifically, we target conditions such as herniated discs, bulging discs, and degenerative discs, as well as the symptoms of sciatica, which is associated with these conditions. And what we found is with disc injuries we know accelerate the degenerative forces of the spine. And when that happens, that's going to lead to arthritis. Exactly.
Do you get to see any spinal stenosis in your practice?
Oh, absolutely. I mean, spinal stenosis is, you know, once again, it's a very common condition that we see inside the office. What we find is that when the spinal bones misalign, that's going to put more pressure on the bones and the joints. You know, when I try to educate my patients, I try to use real-life examples. For example, a tire in your car that goes out of alignment. That tire is going to wear down quicker. And if you don't get that tire back into its proper alignment, eventually your shock absorbers are going to wear down quicker, the axle, the chassis of the vehicle. And exactly, even the engine as well. So by treating patients chiropractically, our goal is to try to unlock the spine to get pressure off of the bones and the joints, which is going to help reduce inflammation, reduce pressure on the nerves, and get a patient feeling better and functioning better.
Fantastic. I understand you brought this model with you, Doc. Let's go over that.
Okay. Well, what we have here is a normal spinal motor segment. As you can see in this segment, the disc is nice and big and healthy. But what happens when the disc starts to degenerate, it's actually going to place more stress on the bones, as we know. And unfortunately, when bones get stressed out, they start to calcify. They build up calcium deposits, which are known as osteophytes. And unfortunately, sometimes these osteophytes develop in areas that can be more detrimental to the patient. For example, you mentioned the spinal stenosis. When these osteophytes develop in the spinal canal, that can lead to the spinal stenosis. Additionally, they can form out here in what's known as a neuroforamen, which is going to also put pressure on that nerve. So once again, when we do chiropractic manipulative therapy, we're simply trying to unlock the spine, get that spine in a better position. Now, we can't cure the arthritis, okay? If you have a tire in your car that's worn down because you didn't properly align it, okay, you can get that tire back into alignment, but the damage is still going to be there. But the tire is going to get prolonged, the life of the tire, and that's what we try to focus on in the office.
And what about this model? What is that model showing?
Okay, well, this model shows a condition known as a herniated disc. What occurs with the herniated disc is the soft gelatinous portion inside the disc will actually start to seep out of place, and that also can cause a stenosis. That can put pressure on the spinal cord and on the nerves, and it can lead to a very painful condition known as sciatica, which I know you see a lot in your office as well.
Yes, that's a common scenario. And for sciatica patient, what you offer is also the decompression. Does that help you?
Yeah, decompression is definitely one of the therapies that we do recommend for the patient suffering from sciatica. Obviously, when a patient comes in the office, we're going to start out with the most conservative approach first. We tend to follow the AMA guidelines as far as these musculoskeletal type of conditions. But if a patient's not responding, then we do have other non-surgical options for the patient. Spinal decompression happens to be one of them, and we have a very high success rate.
Fantastic. I know my partner here, Roman Garcia, also had a question from you.
Dr. Fisher, for anybody that's watching out there, are there any unique physical manifestation of a herniated disc? Are there unique symptoms that are associated with a herniated disc that if somebody experiences these sensations, it should bring up a red flag for them?
Oh, absolutely. I mean, first and foremost, if you're having any pain when you're coughing or sneezing, those are some of the most common signs and symptoms that you have pressure on your discs and on your nerves. Also, if a patient presents what's known as an antalgic posture, they may be leaning forward or leaning to the side. So if you're looking at yourself in the mirror and your shoulders one way and your hips another way, that's also a very common sign that you may have a herniated disc. And obviously, any type of severe pain, sharp pain radiating down into the legs. Those are probably the three most common things that I feel that the audience out there should look at if they think that they may have a herniated disc, and obviously get themselves into a board-certified physician to get the proper evaluation.
Fantastic. Well, we have your name and your website here on the screen, and for patients out there who are having issues with lower back or neck pain and need chiropractic, Dr. Fisher. I think you have another question.
Doctor, yes, well, can I ask the doctor,
please.
Now that we've got him here, we could take advantage of his knowledge.
Yes, please.
Do you think it's possible for a herniated disc to resolve after treatment? You think it's possible for somebody to have a herniated disc and then you treat him and then the herniated disc resolves, it actually gets reabsorbed back into the disc? Is that possible?
Oh, we've actually seen it. We will, first of all, prior to a patient getting the spinal decompression therapy, they've got to qualify for the treatment. The way they qualify for the treatment, number one, they go through a very specific orthopedic and neurological evaluation. Obviously, we clinically correlate their symptomatology, and then they have an MRI. Okay? When these things match up, we can come up with a firm diagnosis. Once the patients do complete the spinal decompression therapy, we can send them back out for a post-MRI. Okay? In many cases, the disc herniation will totally resolve. In some cases, we get a 20, 30, 40% reabsorption of that disc, and that's going to make a huge difference, and it's going to get the pressure off of that nerve and off of the spinal cord, causing the symptoms for the patients.
And along with the resolution of the herniated disc, do you actually see expansion or inflation of the disc space after the decompression?
Yes, I mean that's a great question. You know, as we know, the discs don't have any blood supply. Okay, and blood supply is really important because it brings oxygen, water, and nutrients to all the organs, tissues, and cells in the body. So the spinal decompression therapy is aimed to draw in more oxygen, more water, more nutrients into the disc, which is going to help build up that disc and begin the fibroblastic activity, which is the healing that occurs inside the disc. So, yes.
So the disc can reabsorb back the whatever fluid it is that's in there. It's probably proteoglycans. It's a protein. It's water that is associated that gets drawn into the disc material itself.
Yes, with the spinal decompression therapy, actually what we're doing is we're creating a negative pressure or a vacuum, and that's going to help to draw back in those proteins that you just mentioned.
Interesting. Okay.
Well, at this point, we're going to take a break. When we come back, we're going to see a video that we put together with Dr. Bob Alexander.